3 o'clock in the morning. Your house is completely still. You finally sank into that deep, heavy sleep, the good kind, the kind your body has been begging for all day. And then the signal comes. Faint at first, somewhere at the edge of your awareness. You try to ignore it. You try to roll over and think about something else. But the pressure builds. You throw back the covers, drop your feet onto the cold floor, and shuffle to the bathroom like a zombie. You squint against the light. You do what you came to do. You come back to bed, and sleep is gone. Your mind is running. Work, the mortgage, the kids. You lie there for an hour. You finally drift off, and it happens again. Second time tonight. Third time. By morning you are shattered, heavy-headed, pouring coffee into yourself just to function. Every single night, tens of millions of men go through this exact ritual. 2 trips, 3 trips, sometimes 5, and almost every one of them says the same thing. It's just age. Everybody gets up at night. Nothing you can do about it. I'm Dr. Richard Thompson. I've spent 15 years in clinical urology, and I'm going to tell you something no one at your next appointment is going to say. In 80% of cases, your bladder is completely healthy. It is not the problem. And the pills, the supplements, the herbal blends you've been buying for your prostate or your bladder, they are aimed at the wrong organ entirely. What is actually waking you up at night will genuinely shock you. And once you understand it, you will never look at those bathroom trips the same way again. Let me be direct with you. Getting up at night to urinate is not normal. Not at 40, not at 55, not at 70. That idea that it is just part of getting older is a lie. It is a dangerous illusion, and it needs to be shattered right now. Your body is built differently than you think. Every night, when everything is working correctly, your brain produces a specific hormone called antidiuretic hormone, also known as vasopressin. Think of it as a factory manager sending a memo to your kidneys. Stop. Night shift. Concentrate the urine. Reduce the volume. Run in economy mode. That mechanism is precisely what allows a healthy person to sleep 7 or 8 hours straight without a single interruption. When that mechanism breaks down, it is not a minor inconvenience. In medicine, the condition is called nocturia. That is not a fancy word for getting old. That is a diagnosis. If you get up once a night, that is a warning signal. If you get up twice or more, that is an alarm going off. Because every single time you wake up, your pulse jumps, your blood pressure spikes, and you interrupt the phase of deep sleep in which your brain clears out metabolic waste, neurons repair themselves, and your heart genuinely rests. Years of losing that phase is a direct path to hypertension, depression, and accelerated brain aging. Clinical research shows that nocturia stresses the cardiovascular system faster than smoking. That is not an exaggeration. That is data from published clinical studies. And the most important part is this. The answer is not in your bathroom cabinet. It is not in a bottle of prostate pills. The answer is in a place you have never thought to look. Here is what I see in my practice every single week. A man walks in, exhausted, fed up, and he has already decided he knows the cause. Doctor, it's my prostate. I'm sure of it. He has been to the pharmacy. He bought the advertised supplements, the herbal blends, the capsules with the confident packaging. Then he reasoned, if I am producing so much urine, I need to drink less. So he imposed a strict cutoff. No water after 6, no tea after dinner. He goes to bed with a dry mouth and a sense of discipline. And still, at 2 in the morning, he gets up and releases half a liter. At 4, another half liter. Where is it coming from? He has not drunk a thing. Let me explain this with a simple model. Imagine your home's fire alarm goes off in the middle of the night. What do most people do? They rip out the battery so it stops making noise. The correct response is to find where the fire is. That is exactly how most men treat their nighttime bathroom trips. Your bladder is the sensor. It is not the fire. It is simply signaling that something is happening somewhere else in the body. In 80% of cases, the bladder is perfectly healthy. It is doing exactly what it is supposed to do, emptying what gets put into it. The problem is not the reservoir. The problem is who is filling it during the night and why. Every supplement aimed at your bladder, every herbal tea marketed for your prostate, every strategy of drinking less. They are all tape over the smoke detector. You are fighting the symptom, not the cause. And until you understand the real mechanism, nothing will change. So let me show you what is actually going on. In urology, nighttime urinary problems divide into three fundamentally different types. The treatment for each is different, and what helps one type can actively make another worse. This is why the generic advice you find online fails so often. It does not distinguish between them. Type 1 is global polyuria. That means producing too much urine overall, day and night. You are going frequently around the clock, and each time the volume is large. The usual causes are straightforward. Either you are drinking enormous amounts of fluid, walking around all day with a water bottle thinking more is always better, or you have a blood sugar problem. Diabetes, either type 2 or central diabetes insipidus, pulls water into the urine continuously. If this is you, the pattern is obvious. You go just as often during the day as at night. This type needs a blood sugar test and an endocrinologist. Type 2 is nocturnal polyuria. This is the most common and the most misunderstood. During the day, you live completely normally. You work, you run errands, you visit the bathroom every 4 or 5 hours. Nothing hurts, nothing burns. But the moment you lie down, the nightmare begins. 3 or 4 trips per night, each time a full bladder, large volume. You had half a glass of water before bed. Where did 1.5 liters come from? This type accounts for 60 to 70% of men over 50. And the critical point is this. If this is your type, your bladder has nothing to do with it. Treating the bladder is useless. Type 3 is a reservoir problem. Urges are frequent, sudden, and desperate, but almost nothing comes out. The bladder has lost the ability to stretch properly. It fires at 50 milliliters when it should hold 300. Identify your type. If you recognize type 2, keep listening. What comes next will explain everything. I want to tell you about one of my patients. I will call him Gerald. 57 years old, solid, self-sufficient man. Not the type to complain. Only comes to see a doctor when he is desperate. And he was desperate. He walked into my office with a thick folder of paperwork. Bladder ultrasound. PSA blood test. A bag of prostate supplements he had been taking for months. He told me right away, "Doc, it is my prostate. Has to be. Do something. I am losing my mind. 5 trips per night. 5. Imagine that kind of torture. You finally fall into sleep and you are yanked out of it again and again and again. Gerald had done everything the internet tells you to do. He bought the marketed capsules, the herbal blends, the suppositories. He stopped drinking water after 6. He went to bed parched. And still at 2 in the morning he got up and released half a liter. At 4, another half liter. Where was it coming from? When I looked at his lab work, his PSA was completely normal. He had a mild first-degree prostate enlargement, but that degree does not produce this picture. His bladder was clean. From a urological standpoint, he was nearly healthy. Yet this man was not sleeping and was suffering. So I stopped asking about how he urinated. I started asking about how he lived. Any shortness of breath? A little, he said. When I climb to the 3rd floor, I have to stop. Do your socks leave a groove on your legs by evening? He looked surprised. Yes, an actual indentation in the skin. But doesn't everyone have that? And right then, the picture clicked into place. I told him something that stunned him. Gerald, throw out the prostate pills. I am referring you to a cardiologist. He looked at me like I had lost my mind. Here is what was happening inside Gerald's body, and it is almost certainly happening inside yours. Picture a plastic bottle half filled with water. When it stands upright, the water sits at the bottom. Lay it on its side, and the water distributes evenly. Your body works the same way. 16 hours a day you are vertical, standing, sitting, walking. Gravity pulls everything downward. Blood, lymphatic fluid, the water between your cells, all of it toward your feet and ankles. When we are young, the valves inside our veins hold blood firmly and push it upward. The muscles in our legs contract when we walk and act as a pump. But with age, or if we sit at a desk all day, this mechanism weakens. Valves start to leak. The muscle pump shuts down. Fluid seeps out through vessel walls into the soft tissue of the legs. Quietly, invisibly, up to 1.5 liters of water can accumulate there by evening. You do not feel it. The sock left a slight groove. So what? Then you lie down. And here is where it gets critical. Your legs rise to the same level as your heart and kidneys. Gravity no longer holds the fluid in your legs. All of it, every drop that collected over 12 hours, rushes back into the bloodstream in a powerful wave. The volume of circulating blood rises sharply. Your heart detects the overload and releases a hormone called atrial natriuretic peptide, ANP. The message to the kidneys is brief. Dump the excess fluid immediately, or I will fail. Your kidneys shift into emergency mode. They filter at an accelerated rate, expelling water to protect the heart. Within an hour of lying down, your bladder is full. You get up. You come back. But the fluid from your legs has not finished mobilizing. 2 hours later, full again. And the cycle repeats until morning. That is why Gerald, who had not drunk a drop since 6 in the evening, was running to the bathroom all night. He was drinking through his legs. No prostate supplement on earth could stop that. You might ask, fine, I understand about the legs and gravity, but I also eat. Can food affect this process? Absolutely, in ways that will genuinely surprise you. There are foods that act like a delayed switch on your kidneys, programming them to do most of their work while you sleep. And you are probably eating them at dinner, sincerely believing they are harmless. The first saboteur is hidden salt. When I ask patients what they eat in the evenings, most say something like, "Doctor, I watch what I eat. No pickled herring, no salty snacks." Then it turns out dinner was a sandwich with cheese and cured sausage, or crackers and cream cheese before bed. Here is the fact most people do not know. 80% of the salt you consume comes from processed and packaged food: cheese, bread, mayonnaise, canned goods. 100 grams of ordinary hard cheese contains as much sodium as an entire bag of potato chips. You do not taste it. It is masked by fat, but it is there. That sodium enters your blood, and your body holds on to every molecule of water to dilute it. In the evening, you are fine. But overnight, your kidneys detect the accumulated sodium and begin flushing it. Sodium pulls water behind it like a magnet. You wake up at 3 in the morning, eliminating last night's cheese. The second saboteur is evening sugar: a cup of tea with cookies, a small apple before bed. Simple carbohydrates cause a rapid blood glucose spike. Insulin fires. 2 to 3 hours later, right when you have fallen asleep, blood sugar drops sharply, and your kidneys switch to active fluid excretion. You get the biological equivalent of a water pill from a cluster of grapes. The third saboteur is alcohol. A small glass of brandy before bed. It helps me sleep harder, men tell me. This is one of the most widespread forms of self-deception I encounter. Alcohol sedates you, yes, but it simultaneously blocks vasopressin entirely. Your kidneys run at full filtration speed with no restriction. You sleep through the first urge. The bladder keeps filling until the second urge becomes painful and impossible to ignore. Your sleep quality is destroyed. The outcome is worse than if you had not drunk at all. Before we go any further, I need to say something as a physician. There are symptoms that should send you straight to a doctor. Not to a video, not to a supplement, to a doctor. Know these. First, blood in your urine without pain. Remember that combination. If there is pain and blood together, it is most likely a kidney stone or an acute bladder infection. Miserable, but not immediately life-threatening. But if you see dark red or brown urine, blood clots in the toilet bowl, and nothing hurts, that is one of the most serious early signs of bladder cancer. In men over 50, that finding is a direct indication for cystoscopy, a procedure where a doctor examines the inside of the bladder with a small camera. Do not wait. Do not reason it away. Go. Second, bone pain combined with sudden weight loss. If your nighttime trips are accompanied by a deep ache in your pelvis or lower back, and you have lost 10 to 20 pounds over the past 2 months without dieting, that pattern is a warning for advanced prostate disease that is spread to the bone. That combination demands a full workup immediately. Third, burning and frequency that does not resolve. If it hurts when you urinate and the urgency has persisted for weeks despite treatment, that can indicate chronic infection, bladder stones, or a structural problem that needs imaging. I am telling you this because I do not want you to treat every symptom with a home protocol. Some signals require professional hands and professional equipment. No video replaces that. If none of those apply to you, you can breathe. You are most likely dealing with the fluid mechanics we have been discussing, and that is something you can address starting tonight. So let me show you exactly how. Now for the most practical part of everything we have discussed. I want to show you what I recommend to my patients and what I myself do every single day. A simple 3-part protocol: morning, daytime, and evening. 5 minutes total. No equipment, no cost. Part 1. Morning. The moment you get out of bed, do not head straight for the coffee. Stop for 30 seconds. Stand upright, feet shoulder-width apart. Rise up onto your toes just an inch or two, and let your heels drop back to the floor with a light, firm impact. You should feel a mild vibration traveling from your calves up through your thighs. Repeat 30 times. 1 drop per second. 30 seconds of your morning. What is happening? Inside your veins are small valves that prevent blood from pooling downward. With age and inactivity, those valves become sluggish. This rhythmic vibration shakes them back into action and gets blood moving upward against gravity from the very start of the day. That is your best insurance against evening leg swelling. Part 2. Daytime. One firm rule. 70% of your total daily fluid intake should happen before 4 in the afternoon. A glass of water after waking. A bottle at your desk. Tea and soup at lunch. After 4, only small sips is needed. And remove the salt shaker from your table entirely. Salt food only in the pot during cooking. That single act reduces daily sodium consumption by 20 to 30% without changing what you eat. Part 3. Evening. The critical move. Approximately 1 to 1.5 hours before bed, lie down on the sofa or the floor. Place your legs up on the armrest, the back of a chair, or against the wall. Your heels must be higher than your heart. Stay there for 15 to 20 minutes. Read, scroll your phone, listen to a podcast. What happens? Gravity now works for you. It pushes the fluid from your leg tissue back into the bloodstream. Your kidneys process it while you are awake. 30 to 40 minutes later, you will go to the bathroom and release the 300 to 400 milliliters that would have woken you at 3 in the morning. Before sleep, do 20 to 30 Kegel repetitions. Only the pelvic floor moves. Abdomen soft, buttocks relaxed. Contract, hold 3 seconds, release. Gerald started this with undisguised skepticism. 1 week later, he came back and said quietly, "I woke up once. Near morning. Once. Not 5 times." Within a month, he was sleeping through the night. The protocol handles fluid mechanics. It addresses gravity, circulation, and timing. And for many men, it is enough. But in 15 years of practice, I have learned that there is one more factor most men overlook entirely: the internal cellular health of the prostate itself. Even with perfect circulation, even with your legs elevated every evening and your sodium under control, if the tissue around the prostate is building up unchecked, if blood flow within the gland itself is sluggish, the organ cannot function at its best. A 2023 study from Fukushima Medical University in Japan demonstrated something important. Stromal cells, the cells that accumulate around the outer edges of the prostate and contribute to enlargement, can be metabolized more effectively when healthy blood flow is maintained in and around the gland. The protocol works from the outside, but the prostate also needs support from the inside. This is where I want to tell you about something called Prostavive. It is a natural blend of nutrients specifically formulated to support prostate blood circulation and maintain healthy nitric oxide levels, the molecule that relaxes the inner walls of blood vessels so nutrient-rich blood can reach every cell in the gland. What is in it? Boron, one of the most powerful prostate-supporting minerals known, originally sourced from crystallized deposits in Tibet. Tongkat Ali, used for centuries in the East for prostate health and sexual vitality. Ashwagandha, traced back to 6000 BC, supporting detoxification of buildup in prostate tissue. Nettle root for urinary tract health and healthy hormone levels. Zinc and magnesium, the same minerals that support the bladder's smooth muscle and the pelvic floor. And vitamin D, the nutrient most men over 50 are deficient in without knowing it. 1 scoop a day. The men who combine the Golden Protocol with Prostavive report stronger urine flow, deeper uninterrupted sleep, more energy during the day, and a return of confidence they thought was gone for good. If you want to try it for yourself, I have made it simple. Click on my channel logo. Right there on my channel page, you will find Prostavive. No searching, no guessing. Click the logo and you are there. I'm Dr. Richard Thompson. Your body is not broken. Your bladder is not your enemy. It is a signal light. Now you know how to address the cause instead of smashing the bulb.